Did you know a rare condition could cause copper to build up dangerously in your liver and brain? Let's talk about Wilson's disease and how to spot it before it's too late.
Hello and welcome back to Health Boon, where we simplify medical facts to help you live healthier and smarter. Today, we're diving into something not many people talk about, but absolutely should. It's called Wilson's disease, a rare condition that causes copper to build up in your body, especially in the liver and brain. And here's the catch: most people don't even know they have it until it causes serious health problems.
So, what exactly is Wilson's disease? It's a genetic disorder, which means you're born with it. Your body needs a small amount of copper to stay healthy. It helps with things like energy and nerve function. But in Wilson's disease, your liver doesn't get rid of the extra copper like it's supposed to. That copper starts to build up, first in your liver, then in your brain, eyes, and other organs. Over time, it can cause serious damage if it's not caught and treated early. Let's talk about the early symptoms of Wilson's disease. This part is really important because early diagnosis can literally save lives. Many people first notice problems in the liver. Fatigue. Yellowing of the eyes or skin, called jaundice. Swelling in the belly. Others may see changes in behavior or mental health, especially in teenagers and young adults. You might notice mood swings, depression or anxiety, trouble focusing or sudden drop in school performance. And then there are neurological symptoms like tremors or shaky hands, trouble with coordination, slurred speech. These symptoms might seem unrelated, but together, they could point to Wilson's disease. Here's something practical. If someone in your family has Wilson's disease, it's important to get tested, even if you feel fine. It's inherited, which means if a parent is a carrier, their children could be affected too. And here's a powerful story. In 2024, researchers in Japan found that early screening among children of diagnosed patients helped prevent organ damage before it started. That's the power of awareness. Also, if you or your child shows unexplained behavior changes or liver issues that doctors can't figure out, ask them about Wilson's disease. Sometimes, all it takes is a simple blood or urine test to catch it. Now let's bust a myth. Some people think Wilson's disease only affects the liver. Not true. In fact, one of the earliest signs, especially in teens, is often neurological or mental health related, like sudden depression or clumsy movements. That's why many cases are first seen by a psychiatrist or neurologist, not a liver specialist. The good news? Wilson's disease is treatable, especially when diagnosed early. Doctors usually prescribe chelation therapy, medicines that help remove extra copper from your body. You may also need to follow a low-copper diet, avoiding foods like shellfish, liver, mushrooms, and nuts. And with regular treatment, most people go on to live healthy, full lives. Here's your one simple action step today. Backhand index pointing right. If someone in your family has unexplained liver, mental health, or movement issues, ask your doctor if a screening for Wilson's disease makes sense. At Health Boon, we believe that education saves lives, and this is one of those topics that deserves more attention. White heavy check mark if you found this episode helpful. Please like, subscribe, and share. It helps us keep this platform completely free for everyone. All our content is verified by doctors. Check the description for their profile. And for more info, check out these trusted resources. Mayo Clinic, Wilson's disease. CDC, genetic conditions. National Institute of Neurological Disorders, NINDS. Until next time, stay informed, stay empowered, and stay healthy.